Dr. Barnard has had a tremendous impact on the world we live in today. We might not have modern intensive care without his advancements. Dr. Otto Thanning, a former registrar in Dr. Barnard's unit, once said, "There is no doubt in my mind that he was a father of intensive care, or the concept of intensive management after any major operation." His groundbreaking achievements in the cardiovascular field set off a chain reaction of hundreds of surgeries in the years to come. Patients are the lifeblood of medicine, and the way they are treated helps them live and doctors do more research. He also did not support the idea of being separated due to race. He believed that people are not defined by the color of their skin and that medicine should bring people together. Dr. Barnard impacted history by the first human heart surgery, the world of medicine, and broke barriers between races. Heart surgeries have come a long way since 1967. Before that, there was no such thing as a successful heart surgery. 3 days after the initial heart surgery, a man named Dr. Kentrowitz performed the first transplant in America. He was aware that the first transplant had already taken place in South Africa, yet he still wanted to be a record setter in America, and by the following year, 104 heart transplants took place.
So what is a heart transplant? According to the Mayo Clinic, a heart transplant is an operation in which a diseased, failing heart is replaced with a healthier donor heart. A heart transplant is a treatment that usually is reserved for people with a condition that hasn't improved enough with medications or other surgeries.
In 1967, a 25-year-old accounting machine operator named Denise Ann Darvell and her mother were hit by a drunk driver. The mother was sadly killed by this, and Denise was declared brain dead. Her father, Edward Darvell, was approached by a doctor, Dr. Bozeman, in Grootscher Hospital with a question. He knew of a patient in the hospital who was dying. This man's name was Louis Waskinski. He was in a terminal state of heart failure. Dr. Bozeman thought Denise would be a perfect candidate for a heart transplant, and through all the pain he was going through, Mr. Darvell responded, "I remember the birthday cake she had gotten for me, with hearts on it and the words, 'Daddy, we love you.' I remember, too, a bathrobe she bought me with her first week's salary from the bank, and I thought she was always giving away things to other people. So I decided that she would have said yes to Dr. Bozeman if he had asked her instead of me." This courageous decision led to one of the cardiovascular's greatest accomplishments. Many doctors had endlessly tried for a successful heart transplant, but the operations were tricky. Dr. Christiaan Barnard dedicated his life to medicine. He spent 9 years practicing before he ever extracted a human heart. He practiced on animals such as ill dogs, and he performed surgeries on hearts, but to him, that was not enough.
Heart surgeries were still a fairly unexplored topic at the time, so when Dr. Barnard's unit at Grootscher Hospital heard they were going to be performing a full operation, it put a lot of pressure on them.
The surgery itself went very well. After the surgery, Dr. Barnard and his team left the hospital normally. Little did they know their lives were changed forever.
However, Dr. Barnard was not so worried. He had worked with hearts before and he knew his way around one very well. His positivity in his own work was not only what set the tone going into the surgery, but was the factor that helped them to succeed.
They got called in the next morning very early and were told to wear their uniforms. And when they got to the hospital, reporters crowded around, screaming questions, and soon Dr. Barnard was a very familiar name. When asked about the conditions of Mr. Waskinski, Dr. Barnard said,
"It was amazing to see how he lost all evidence of heart failure. The swelling of his legs disappeared, the swelling of his liver disappeared, his lungs became dry, and he was mentally well, and I really did not believe that it will not be successful."
A particular issue of Times Magazine on December 15, 1967 states, "Now, almost 4 hours after the first incision, history's first transplanted heart was in place, but it had not been beaten since Denise's death. Would it work? Barnard stepped back and ordered electrodes placed on each side of the heart, and current was applied. The heart leaped as a shock began a swift beat. Dr. Barnard heart leaped too. Through his mask, he exclaimed unprofessionally but pardonably, 'Christ, it's going to work!' Work it did." People were in awe at Dr. Barnard's amazing achievement, but when he was asked about it, he said,
It was not such a big deal. It was another heart operation. The only time that I realized that I was doing something different, and this was really the moment of truth, is when I looked down into the chest of that patient and there was no heart. I'd seen many open chests, but I've always seen a heart there. And this is the first time that I saw a living human being without a heart.
Cape Town, South Africa was put on the map, making history in 1967 when the first human heart transplant succeeded.
Apartheid was a political and social system in South Africa and enforced racial discrimination against non-whites, mainly focused on skin color and facial features. During this time, apartheid sadly had a major effect on the medical field.
People were being beaten down and separated solely by their race. Separation was spread throughout schools, stores, and even hospitals.
Deadrea Barnard, Dr. Barnard's daughter, when asked to recall about the time, said,
I remember very well in those days it was, apartheid days, and they had a special intensive care unit for colored and black people and one for white people, and he said no, he's going to have one intensive care unit where the best nurses will nurse and the patients will all lie there in that intensive care unit.
Lawrence K. Altman, a writer from the New York Times, says, during apartheid, Dr. Barnard ignored many racial barriers in the country, including allowing mixed-race nurses in the operating rooms to treat white patients and transplanting the heart of a white woman into a black man. Dr. Barnard condemned South Africa's racial policies while refusing to agree with the country's political system ought to be turned over by the black majority. Dr. Barnard believed that medicine was about humans, and we in fact are all human. He even went against the system even more in 1968, a year after the initial surgery to transplant a heart of a young black man into a white dentist named Philip Blaber. Mr. Blaber survived for about 19 months, but passed away due to medication complications after that. Unlike a lot of doctors, Dr. Barnard would perform a surgery, then stay with the patient as long as they needed, even sometimes without sleeping for days so he could monitor their progress. He also got very emotionally attached to every patient, and when Louis Worskinski passed away on December 21st, 1967, just 18 days after the surgery, Dr. Barnard was crushed. Although he passed away just a short amount of time after the surgery, his heart was fully functional and healthy. He passed away from pneumonia, but till his last dying breaths, his heart was going strong. Along with being a very emotionally attached person, he was also a very generous person. He always gave opportunities to people that he felt had potential.
One of the people that Dr. Barnard thought had potential was a man named Hamilton Nakki. He worked as a gardener for 6 years at Groote Hospital, but right after that, his life changed forever.
I came to Cape Town to look for work because my family was very poor. I couldn't manage to go to school. I take standard 6. Now from standard 6 I came here to work with the gardener.
He heard about a position at the animal house at the medical school and started doing surgeries there. He moved his way up to being an assistant to Dr. Barnard, doing heart transplant in the laboratory on animals. Dr. Barnard saw immense potential in him and thought he was very capable no matter his race or ethnicity.
So many people with tremendous potential has never had the opportunity to develop that potential. I always say the ingredients to success is firstly a certain amount of ability, and the second one is opportunity. And there are many people who are probably as skilled as Hamilton, as gifted as Hamilton, that has never had the opportunity to explore what God gave them.
In fact, Dr. Barnard saw so much potential in him that when Mr. Nakki's wife was going to have a baby, he bought tickets for Mr. Nakki to go be there when his son was born. And Mr. Nakki looked up to him so much that he named his son Barnard. Dr. Barnard passed away on September 2nd, 2001. Although he passed away, he was not forgotten. He definitely left his mark on the world and broke down barriers between people. Seeing he cared so much about the world around him, he not only gave chances to people who were dying, but people who were living.
A heart surgeon, Dr. Willie Cohen, who heads the Christiaan Barnard Memorial Hospital Heart Transplant Unit, said that decades ago, 30 to 40 heart transplants were carried out every year in South Africa. Lately, only about 15 to 20 a year were being done. Dr. Barnard was a loving person, but he mainly thought of medicine. He was diagnosed with rheumatoid arthritis in his hands, and for a surgeon, that was terrifying. He was afraid that he could never perform a surgery again once the arthritis took over. However, the doctor said it would never be so bad that he'd be crippled from it, and that taught Dr. Barnard a lesson. It taught him that no matter how bad the news is to give to a patient, give them hope, because that bit of hope could change their life.